Let's talk about your opponent, Gabrielle Giffords. Gabrielle Giffords has a reputation for being a blue dog Democrat. What is a blue dog Democrat? What does that mean to you, and what should it mean to the voters of Congressional District 8?
Well, what a blue dog Democrat is nowadays is a Democrat that says they're a blue dog, meaning they're a fiscal conservative, in order to get elected in Republican districts, like this one. District 8 is a Republican district. By the numbers, it is a heavily Republican district, and before Representative Giffords, it was held by a Republican for 20 years. So she had to tell the people of this district she was a blue dog in order to get elected. Well, since this current president has been elected to office, our blue dog representative has signed on to a $3.6 trillion budget that quadrupled the national debt, has signed on to a $787 billion stimulus bill that just throws pork barrel spending around this country like no one's ever seen before. So I think she can officially surrender the title of fiscal conservative or blue dog Democrat. That went out the window when she signed on to the stimulus bill.
Let's talk a little bit more about what Jesse Kelly intends to advocate when he gets to Congress. What, say, are some of your plans for putting America's finances in order? What things will you do in the Congress to speak to Tucson's concerns in Washington?
I'll do the things that have worked throughout history. I'll cut taxes on everybody, not just the rich, not just the poor. Everyone needs to pay less in taxes. The government will find a way to manage its budget the same way everyday people find a way to manage their budget. They will make do with the money they get. You cut taxes, which will grow the economy. You stop this irresponsible spending that goes on right now. These pork barrel projects that go on to special interest projects, they have to stop right now. We have representatives like ours that actually brag about the pork barrel spending. It must stop. Government has gotten so wasteful and bloated, it's unbelievable. The bureaucracy must be shrunk. I just spoke with a pharmaceutical rep the other day. He told me because of the bureaucracy, because of the red tape, it costs them $1 billion just to get a drug to market. And once that drug is to market, it has a 60 to 70% chance of failure. $1 billion because of government red tape. And we wonder why we pay so much for the drugs we need. That is a direct result of government intervention. We need to cut this government intervention down everywhere.
Yeah, Jesse, you're a family man. Healthcare is a very important issue to you. Is that correct?
It is.
Now, what we hear a lot about in the advocates for a single-payer, nationalized healthcare, socialized medicine debate is that it would take the burden off of the consumer or the patient. What do you think about socialized medicine?
I think that's absolutely correct. The patient will no longer have to burden himself with wanting to live a long time once the government gets involved and starts rationing health care. Because that is all they will do is ration health care. What thing has government ever taken over? What entity has government ever taken over that has then prospered? It is precisely government intervention that has caused the medicine to get so expensive in this country. Healthcare, the costs are out of control. They absolutely are out of control, but that's because of the government. The government won't pay off all of its Medicare. The government forces people to get these gold-plated Ferrari medical packages. Why can I not shop for healthcare the same way I can go to Geico.com and shop for auto insurance and get just the care I want? We have all these government mandates, all these government entitlements. Medicare is close to being insolvent. And now the government's solution for this is more government. We need less government. We need completely unlimited healthcare savings accounts. These are things that will work for everyday people. We don't need government to ration the care we can get. I don't want any government telling me that I don't have access to a life-saving cancer drug, or telling somebody I care about that I don't have access to a life-saving cancer drug. These things happen. These things happen all the time in Canada and Britain and states like Oregon that have state-run health care. These things happen every day. You have to go before a board of unaccountable, unelected bureaucrats, nameless, faceless individuals, and beg for a drug that may save your life.